the time in this experience and really, I think, a series of compelling presentations. Certainly the team that came together. This did not feel like the first event of its kind, and it was. So kudos to the Dr. Ringo and I want to provide some perspective about the winner, and I think we want to thank the judges as well. This started out around a concept of collaboration to try to affect change from a healthcare perspective, and this idea that we're going to be most impactful to the extent that we can actually leverage the combined contributions of many constituents within the healthcare ecosystem. No one organization represented here today on the panel, no one constituency represented in the crowd is going to independently affect healthcare in the way that it needs to be impacted. But together, I think we've got an incredible opportunity to really drive this forward. And I felt a sense of optimism and creativity within this group today and within the audience today, and certainly hope within the presenters today in terms of their willingness to look at persistent challenges from a fresh perspective, and frankly from a perspective that at times entrenched interests don't necessarily consider. Also want to congratulate, it's not easy to get up in front of a group like this and to try to take something that you've been committing your time and energy to for probably years and encapsulate the value of that in 5 minutes. And I thought our presenters just did a phenomenal job really bringing to life what you clearly can see they are passionate about. So thank you so much for all the presenters.
If you look across the panel of judges and see what's represented, it is, to what Brian was saying, something that's very different. We're looking at a problem that all of us have to deal with across the city, across the state. And coming together as partners in new ways to deal with those challenges is part of what we want to get to. And I think if you look at the presenters today, they're all in their own way trying to do that as well. In a very challenging environment where again they're trying to deal with entrenched interests, but in a way that cuts across what used to be barriers, what used to be impediments to getting to where we have to go. And what we really wanted to look at today was, what are those companies, what are those ideas that can get us to a new way of looking at things, to a new way of solving healthcare challenges, and in doing it in a way that brings a lot of varied groups together. And I really do want to thank all of the companies. It was tough, as Brian said, to get that down in 5 minutes, everything that they were so passionate about, and getting that across, and then answering our questions in another 5 minutes. So really phenomenal job, and thank you to all of you for being here today.
All right, so we have our check, and we invite Brian and Dr. Ringo to unveil the results of our inaugural challenge.
Why don't you over here and read these signs?
Sure.
Yeah, so we're not mic'd, but hopefully everybody can hear us in the audience back here, back right corner. Perfect, thumbs up, awesome. This was a tough decision, and I would say that part of what we came back to in the decision framework and the conversation that we had was the initial premise, which is the idea that how can we come together, not just individually, but collectively to affect some greater change. And if we're talking about here is disruptive transformation and not incremental shifts in the market, picking a partner that we thought could bring together multiple constituents was a critical part of that decision-making framework. And so we've chosen Socially Determined to be our as we present you with this $50,000 check. There's a sense that the impact that we want to have specifically in Maryland and specifically in the city of Baltimore where we stand today. And we believe the opportunity that exists with Socially Determined, not just in collection and aggregation and analysis, but in the ability to bind together constituents. You've got 2 primary constituents here today that are willing and interested to partner with you. You've got another 2 constituents represented here on the judging panel today. We'd like to earmark this $50,000 to be specifically directed to affect change within the context of Baltimore. Yeah.
So first, that's amazing. Thank you all. Despite the ability to think nationally how this works, when we think about caring and supporting
given us the opportunity to care for them. It happens locally, right? And we need to braid and integrate all of our collective strengths together to be able to do that. So we would be honored to work with all of you all as part of that. It's great.
Thank you.